Hello, I'm Chief Mayers. Did you know every minute someone in cardiac arrest goes without CPR, their chance of survival decreases 7 to 10%?
Hello, this is Chief Michaels. Did you know with the activation of Anne Arundel County's PulsePoint app, during the dispatch of a cardiac arrest, a private citizen trained in CPR can respond to public places to assist with or initiate CPR. This saves valuable minutes for the person in distress.
Hello, this is Dr. Wendell. We want you to be the first line of defense, and we're going to teach you exactly how. Whether you find a person unconscious and activate 911 yourself, or you respond to an alert from your PulsePoint app, here are the 7 simple steps to help save a life.
Let's take a minute to discuss what to expect when you call 911 in Anne Arundel County. The Public Service Answering Point, PSAP for short, is the police department. If you request fire or ambulance assistance, you'll be transferred to another call center. Don't get discouraged. Both operators will remain on the line with you, and the most appropriate help will be dispatched quickly. It is important to answer all the questions as they are asked to expedite this response. You should know the phone number from which you are calling, the address of the emergency, the name of the business, and suite number if applicable, and the closest intersecting street to the response location, also called the crawl street. 911 operators will process the call as quickly as possible and can instruct callers on life-saving treatment. This includes how to perform CPR. Step 1. Make sure the scene is safe. We want you to be safe. Before approaching someone, look for anything that might harm either of you. If you see something, stay away. Calling 911 is all that we ask you to do. Step 2. Place the person in the proper position. Once you verify the scene is safe, you can approach the person. Make sure they are lying flat on their back. Kneel at their side with your knees close to their chest. Step 3. Verify the need for help. Tap the person's chest and shout, "Are you okay? Are you okay?" This should elicit a response. If it doesn't, you will know they need additional help. Step 4. Shout for help. You, go call 911. You get the AED. If more than one person responds when you shout for help, make sure the person you asked to call 911 or to get the AED knows what you're talking about and knows that you're talking to them. Make eye contact. Call them by name. Whatever it takes to make sure they understand they're responsible for this task. If no one responds, but you have a cell phone, call 911 and put the operator on speaker. Now, if no one responds to your shout for help and you do not have a cell phone, that's when you go call 911 and get the AED if one is available. Return to the scene as quickly as possible. Since you are going by yourself, if you do not know where the AED is, do not waste time trying to find one. Instead, start good quality, hands-only CPR. As others arrive, send them to look for the AED. When they bring it back, turn it on and follow the prompts. Apply it to the unconscious person. Step 5. Check for breathing. Check for breathing by scanning the head and chest for at least 5 seconds, but no more than 10 seconds. You are looking to see if the chest rises or if the person breathes like you or I breathe. If you do not see any breathing or are unsure if they're breathing or only see gasping, it's time to start CPR. Step 6. Start with chest compressions. First, place the heel of your hand on the lower half of the breastbone in the center of the person's chest. I use my dominant hand, but whichever is most comfortable for you, you will do. Then place your other hand on top of the first hand, interlocking your fingers like so. Sit up on your knees, leaning over the person's chest with your hands in place. You should see a straight line from your shoulder to your elbow to your wrist. Push straight down on the chest at least 2 inches in depth at a rate of 100 to 120 compressions per minute. You can pace yourself by singing "Staying Alive" or "Baby Shark" in your head as you do the compressions. Providing compressions is a lot of work. You will get tired. The more tired you are, the less effective your compressions will be. Good quality compressions are very important. If someone else is on the scene and they know CPR, take turns providing compressions. Switch about every 2 minutes. Communicate before the switch so that each of you knows exactly what to expect. This minimizes the time off the chest and maintains that 10-second span we spoke about earlier.
AED stands for Automated External Defibrillator. It is a portable device that uses an electric shock to restore a regular heart rhythm. There are many different brands of AEDs, but they all function in a similar manner. Good quality CPR combined with the use of an AED offers the best chance of survival for someone in cardiac arrest. AEDs can be found in many places like public schools, local malls, airports, public pools, even some private businesses. Check to see if your building has an AED. If it does, make sure you know where it is and how it works. Step 7 is using the AED. AEDs are safe, accurate, and easy to use. If available, they should be used whenever chest compressions are being given. If the AED is not available right away, it should be used as soon as it arrives. To use an AED, turn it on either by lifting the lid or pressing the green on button. Follow the instructions as they are given. Some common instructions you may hear are: place pads on patient. AEDs usually come with 2 sets of adult pads and 1 set of pediatric pads. Each set of pads have pictures showing how they should be placed on an unconscious person. Pull away the backing and place the pads like you see in the pictures. Plug in pads connector. Some AEDs come with pads already plugged in. If this is not the case, there should be a picture on the AED showing you where the plug is located. Stand clear. Anytime the AED advises to stand clear, it is important to do so. If you are touching the unconscious person when the AED is analyzing it, it could read your heart rhythm and determine no shock is necessary, when in reality a shock should be given. Should the AED wish to provide a shock, make sure no one is touching the patient before pressing the shock button. This keeps everyone safe and provides the appropriate treatment in a timely manner. These are just a few of the prompts you may hear from an AED. Remember, once an AED is being used, it is important to follow the instructions as they are given. Here are a few tips to consider when using the AED. An AED should be used as soon as it arrives. The first step in using an AED is turning it on. Follow the prompts as they are given. AEDs will not proceed with additional instructions until the first instruction has been successfully completed. You must use both pads for the AED to function properly. Again, reference the pictures for placement options. It is important to use the appropriately sized pads. Adult pads should be used for anyone 8 years of age or older. Pediatric pads will not work on an adult, so if you are unsure of the person's age, treat them as an adult and use the adult pads. When the AED says "analyzing now," no one should be touching the unconscious person. This is the perfect time to switch compressors if there are others on scene who have been trained in CPR. The more rested you are, the better and more efficient your compressions will be. Before you press the shock button, check to make sure no one is touching the person. You can do this by loudly stating, "I'm clear, you're clear, we're all clear," as you look and verify everyone is clear. There you go. As we mentioned before, we want you to be safe. Since the AED is a machine that delivers electricity, keep these special considerations in mind when applying it to someone. If someone has a lot of hair on their chest, it may prevent the AED pads from sticking adequately. Use the included razor to quickly dry shave the area you will be sticking the pads to. If a razor is not included, place the extra set of pads on the person's chest. Press them down firmly, then forcefully rip them off. This will remove the chest hair and allow you to apply a new set of pads to the bare skin in a secure manner. It is important to remember electricity and water do not mix. If you find someone lying in water, quickly remove them to a dry area. If someone has water on their chest, or if they are sweating badly, quickly dry them off before applying the AED pads. AHA says it's safe to use an AED on someone found lying in snow or a small puddle. But if you do not feel safe doing this, quickly remove and dry the patient prior to applying the AED pads. If you are not able to move the person and do not feel comfortable applying the AED, continue good quality hands-only compressions until help arrives. Some people have implanted devices to help their heart function properly. If you notice any square or round devices protruding from the skin in the chest or abdominal area, they probably have a defibrillator or pacemaker. It is okay to use an AED on someone with a device, but we do not want to place the AED pads directly over these devices. Instead, place the AED pads in an alternate location. One option is the front-back method. You will place one pad in the center of the chest and the other pad in the center of the back as noted on the pediatric AED pads. We never want to place an AED over a medication patch. If you find a medication patch on someone, use the gloves found in the AED to safely remove it and wipe away the medicine prior to placing the pads. If you do not find gloves in the AED, simply leave the patch alone and place the AED pads in an alternate location. Consider the front-back method.
Hello, my name is Autumn Snyder, and I am the CPR coordinator with Anne Arundel County Fire Department. Today, you've learned the 7 simple steps to help save a life. Remember, if there's an emergency, the easiest, most effective thing you can do is recognize the need for help and activate emergency response. If someone needs CPR, push hard and fast in the center of the chest at a rate of 100 to 120 beats per minute. When the AED arrives on scene, use it. If you need instructions, ask the 911 operator. Thank you for taking the time to learn hands-only CPR. You are helping to make a difference in your community, and we appreciate you.